I'm excited to talk to you today about the Rex implants or the Wedge implant. We've been waiting for this product for a long time, and finally we got the FDA approval. It's the thin implants that work very well in thin ridges. And after working with this product for a year, I accumulated enough cases that I can be able to share it with you and let you know my experience working with this amazing product. I will be including a lot of clinical cases and at the end, an interview with the CEO of the Rex Implant Company. Why am I so excited about the Rex or the thin wedge implants and what's so special about them? Well, for the longest time, the only solutions that I have for patients who did not have a thick ridge was to perform a bone graft procedure, whether it was at the time of the implant placement or as a separate surgery where I'll do the bone graft and I get back and do the implants. Well, at least right now, we have another alternative to do the bone graft, and that is use whatever bone you have and place a thin wedge-like implants in those spots. So how do Rex implants work? Well, as you can see, the Rex implants are thin titanium alloy implants that they will be surgically placed in your bone just like any other implants, but the surgical technique and how they are placed is completely different. The conventional implants are round and they are placed with a rotational device. The thin implants are wedge in shape and they will be placed by piezo surgery and by press fit device. The main advantage is that the thin implants will help protect whatever left of the bone. When you place an implant too close to the outside and there is a certain distance that we would like to keep, which is anywhere from 1 to 1.5 millimeter, the more is better. If you do less, we put a lot of pressure on the outside bone and that bone will disappear, leading to implant failure. And this is how much we would like to have from the bone. You can put one implant, you can put multiple implants and then connect them together. So depending on the situation, whether it is single implant placements or multiple implant placement. This will be the difference between the instrumentation. The regular implants will require a rotational placement device, while the Rex implants will require piezo surgery and a mallet, basically a pneumatic mallet that will help press fit that implants in. And that's why we recommend patients that they have to find a surgeon that is trained very well with this implant. Okay. And having a thin implant does not mean that you can place the implants wherever the bone is. You still have to place the implant in the right spot where the direction of the force will be along the long axis of the implant to ensure that the implant will survive. Because if it's an off-center, high bite force, the implant can fracture and lead to its failure. They come in different size, shape, and style. So you have the thin implants, the 1.8 millimeter, you have the 2.9. We call some of them soft tissue level and bone level. And depending on the situation, we can use each implant accordingly. Being thin does not mean weak. The fatigue strength of that implant is equal to 3.5 millimeter conventional size implant. And of course, if we want more strength, then we can use the thicker wedge implants, such as the 2.9 millimeter. I would like to share with you some clinical cases and show you how it's done. So if you don't like to see a surgery, this is a good time for you to stop and then go into our website and give us a call if you have any question about this. And if you can stomach seeing some surgery, let's keep going. So let's look at a clinical example. Here we have a patient who needed to have 4 anterior teeth removed. And when we looked at the CT scan, we realized that the bone is ultra thin and we cannot use a regular size implant. So we decided to give the Rex thin wedge implants a try. And let's look at the clinical steps of how we do this. We start by removing the teeth. And here we removed 4 teeth, came out in a good way. And we really, when we're taking these teeth out, want to make sure that we are doing atraumatic extraction so we can preserve as much bone as we can possibly can. Then we start using the piezo surgery appliance to clean the area, and then to start the implant preparation site. The Rex implants work exclusively with the piezo, which is an ultrasound preparation technique that it is different of the conventional style implants where you're using a rotational device, whether it's air driven or electric driven. So the piezo ultrasound surgery is very unique, and actually is very unique to the Rex implants or the Wedge implant. The steps are creating a groove or a slots where we can go ahead and go through steps of expanders depending on the size of the wedge implant that we're trying to place. If it's the small implants, then we use less expanders. If it's the larger implants, then we use different steps of different expanders. We want to make sure that we're putting the implant in the right spots, and we use a multiple of verification jigs. And this is an example of how we use the expanders. We put it in, and then we apply gentle forces to tap it in and increase the size of the ridge without doing too much bone removal. Remember, this is a situation we don't have a lot of bone. So by using this technique, we utilize the patient's own bone and we try to expand it a little bit. We go through the process slowly using a pneumatic force, and it's all delivered automatically through a special device. When the implant's position or positions is verified, we go ahead and place the implants as we can see right here. This is an implant being placed, and it's been pushed down differently than the conventional style implants where we place the implants in a rotational way, which makes the placements of these implants unique and require a good amount of training and familiarity with the surgical technique. This is why I urge patients that they need to make sure if they want to have this implant that they are using a surgeon that has been trained and have a lot of experience doing this procedure. We can tell from this picture that it is that the implants are placed in the right spot, and we always like to use a surgical guide to place the implants. The implants will be left to heal in the bone for 2 months, and during the time the bone will integrate very well around them. Initially we have a mechanical stability, and with time we will have the true stability that comes from the bone healing around those implants, or what we call osseointegration. So after going through the steps of taking the teeth out and putting the implants in, implants will mature inside the bone. When the right time comes, then we go ahead through the restorative phase where we make an impression, and then we fabricate the final crown or bridge depending on the situation, and we deliver this appliance to the patient. This is a fixed bridge. This is something that will be solid, non-removable, and we were able to get the patients what they want without having to use advanced and complicated bone grafting, and we were able to give the patient something solid that they'll be very happy with, and help them with their function and with their life. That's not the only way that we use Rex implants. Sometimes we use them to help other implants, like in full mouth rehabilitation, here where the anterior implant sites is very thin, and we are taking all the teeth out and putting multiple implants. So rather than to leave the anterior site without one, we decided to put 2 Rex implants, and we didn't have to use bone graft or expand the surgical side. So as we can see, the implants went in and a solid bone, and we're able to use whatever bone we have to help a large case success. We can also use the Rex implants to place a single crown, as we can see in this situation. So there is a lot of different way of utilizing the Rex implants. Before you get into it, or to go to someone who does not have any idea, please make sure that the surgeons who are placing those implants is familiar with the steps and have knowledge about this technique.
We have with me Giuseppe Becciolotti. He is the president and CEO of a very interesting product that I would like to share with you. I did my surgery today, and he was gracious to come all the way from Ohio to help me with the surgery. So I just thought I'll have his thoughts on how did this system came about, and then just tell our
Sure.
colleagues where.
Yeah, it comes from, a simple idea actually, that is finding an implant shape that better fits the anatomy, especially on narrow ridges. When you have a narrow ridge, of course, you don't have a lot of buccolingual dimension. And with piezosurgery, you can make incisions of any shape. And that was really what made it possible.
Okay. I know your father is involved with this, Dr. Vercelotti. He's the developer of the piezo.
He's the developer of the surgery.
And he is the one who is start using the implant, and then he start sharing it with us. And last December, we got the FDA approval to have it used in the United States. But the system has been used in Europe for a long time.
Yes.
Before that.
It's been available in Europe since 2018. So it's going on many years at this point, actually.
And from my experience, doing the course and the first implant surgery, that it's an interesting system because it works for people who really have no other options. That it's just gonna for them to have an implant is gonna be almost a miracle. Any system will able to provide a good solution. Implants come in two different sizes, and also in two different tissue type.
Exactly.
So we have, that's what we see right there is the tissue level. And as you can see, this one has a rough surface, for example, that goes all the way to 3-4 millimeters below your head. And also it can be done with bone level.
Yes.
And this is more for the cosmetically side. So you have that options.
So we have two options for tissue level in the two different thicknesses. So we go as thin as 1.8 millimeters. And then we have a 2.9, always tissue level. And then we have a bone level 2.9. So you have a few different options for different cases.
And what do you think about the learning curve? I mean, I've been placing implants for 25 years, and it was interesting to do the first implant. That it is definitely, I'm not scared of doing it, but it definitely is not something that you want to go and do your most complex case right at the beginning.
Yes.
There is definitely used to rotational surgery and not used to the piezo. This is a press fit implant, and it's not to discourage anybody from doing it. It just
it's a different mindset.
It's a different mindset
for sure.
It is rewarding, when you see it at the end, and you have a patient who you thought that they will never get an implant, right? with implants now. So
you can really use the anatomy that is there and go in and place an implant immediately, where you would maybe not have other options, or those bone augmentation procedures are lengthy and costly, of course. But the learning curve, I'd say, it's always important to understand, the concept behind it, and to try it. So hands-on exercises, I think, very important, because as you said, there is piezosurgery, but there is also press fit. So you need to learn how to do the expansion first, and then the press fit.
And that's what I did. This is what I did at the beginning. I went. We met in Boston, and Giuseppe was there. Dr. Bertolotti was there, and it was a full day. I think it was 8 hours. Part of it was clinical presentations, and half of it, the other half, was just the hands-on. I couldn't place the implants without the hands-on, so that was a must. But I have to say that I saw the design almost 8 years ago. Around that year, 2017, 18, when when they were presenting it in Europe at the IDS symposium, and I couldn't wait to have it here because I think it's another things that we have. It's another trick. It's another procedure, to help people that can otherwise can't have the procedure done, and that's what I'm excited about. The other things that I was impressed with is the 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 library expansion. So we have a lot of implant sizes, dimension, and then every single prosthetic components is available for conventional prosthetic design and for digital world. Um, I care less for a system that I can restore and put a crown on. And this is a system that has a lot of flexibility. So there is um, there is no need to compromise on the prosthetic. It have all the different components, and the interesting thing is if you get a chance to see any of the presentations that they have, and you'll see the history of the system, it will be I was very impressed. I was very well. Let's just put it this way: Giuseppe is a PhD, by the way, and he works on the design, and he has a team with him working on the design, and the attention to details and all the the mechanical step, the design step, engineering step. That's what I'm trying to get to: the engineering steps of how to make something this small work.
Yes. Well, and, this has been on the market since 2018, but the project really started in 2009. So we have patients that were in the first pilot study that have had implants for 10, 12 years at this point. And the results are great, which is, very rewarding, is what we wanted to have before we brought it to market. First, like this.
So I mean, this is I mean, if this is the implant, as you can see, you have the dimensions from here, from mesial to distal, is a 5 millimeter, and then you have thickness of 1.8 for one size and 2.9 for the other size. So you have a different length, 9, 11, and 13, and then you have a different width to 1.8, and all the testings that were done on this, you will see that there is solid. They're solid implants, and they can take on a lot of load. But to have the ability to put a 1.8 millimeter in a tough site is just it's a great thing to be able to do so. I'm just here to tell you that I'm a beginner. I've done thousands of implants with the conventional technique, but I can't hide my excitement. I'm always interested in doing something new, and this is definitely something new. And I'll take the opportunity to thank you again.
It's my pleasure.
For coming in and to help me with this, and that's the beginning of a long relationship. So appreciate it.
Wonderful. Thank you very much.
If you're getting value out of this video, please like and subscribe so we can reach out to more people like you.